Welcome to the NIHR Leeds BRC online research seminar series. My name is Dr. Yusuf. I am a rheumatologist and the Academic Capacity Development Emerging Lead. On behalf of my colleague, Dr. Carol Burnett and Professor Anne Henry, who are both the ACD leads. So today we are proud to present a talk on funding opportunities. So this is very timely since some funders such as NIHR has reorganized their package funding for career development fellowship and etc. So today we are privileged to have two speakers from the University of Leeds Research and Innovation Development Officer and Manager, Dr. Nazia Nasir, who will be enlightening us about NIHR. And also we have Dr. Bethny Morrissey, who will be updating us about UKRI. So just a few house rules before we proceed. Just to let you know that we have automatically muted everyone so that the speakers can present without any noise or interruption. We will have a Q&A session at the end for both Nazia and Bethny. So we encourage for you to type any question that you have in the chat box so that I can read out questions at the end of the session, or potentially if you want more further clarification, we'll be able to allow you to ask yourself as well. Just letting you know that the session is recorded and all the recordings will be available on our Leeds BRC YouTube website. I just want to show something that because we are collecting feedback so that we can improve our online series. So basically, if you have any phone camera, so please have a snap now, and I will show you at the end as well. So basically, this is the QR code for our feedback survey. So it should take about 2 to 3 minutes. So it will definitely help us in order to improve the session and also let us know what are the topics that you want us to organize. We will also send this to all the participants today through emails as well, in case if you don't have any phone with you. So that's good. So without further ado now, so I'm going to invite Dr. Nazia Nasir to start with a talk.
Thank you so much for inviting me and Beth. I'll just start sharing the slides and just let me know if you can see what I'm trying to share. So can you see the full screen mode of the slides?
Yes.
Okay, that's good. So Beth, I think so you will be starting first.
I will be. So good afternoon, everybody, and a very warm welcome to our presentation on what we hope might be inspiring for you to not only identify more, but also find some research funding opportunities that are both within the area of expertise that we have within our school. So next slide, please.
Yep.
So as mentioned, we are recording this session. So if you would like to not be a part of the recording, just for now turn off your mic and your cameras, and you won't appear on the recording. And next slide. At the moment, we will ask if you just remain on silent as mentioned, but please do make use of your questions, and you can put them in the chat and we'll come to them at the end. And there's instructions there for how to turn on live captioning. Next slide. Any questions, any issues, pop them in the chat and we'll get to them as appropriate. So in today's workshop, what we'll be covering is a bit of a snapshot, really, because you can imagine just how vast the funding landscape is, especially in the health and life sciences. So we'll be looking at fellowship, research grants, looking at the current funding landscape, looking at some current funding opportunities, how to find them, and support and contacts that we can offer here at the university. So we'll start by talking about fellowship and research grants. So both grants and fellowships are an opportunity for you to really develop your research. Both the routes of grants and fellowships will help you if you have thought about a research question, if you have some burning desire to look at something in more detail, a grant or a fellowship will enable you to do that. What a fellowship offers, for which a grant might not necessarily do, is an opportunity, that's my cat saying hello, an opportunity for you to develop yourself and to develop your further career and really get you thinking about where you want this to happen. At what institute do you want to develop your career? Where might you want to end up? Next slide, please. So if we have a look in a bit more detail about the differences and opportunities that a research project and a fellowship can offer you. A research project is quite variable in the length, and it normally requires a smaller percentage of your PI time. The research project is normally quite focused. So for the project, you will submit your idea, you'll submit your workflows, you'll submit your Gantt chart, and for that research project, you're normally expected to maintain that line. The focus of the funding really is in the investment of the idea and the team behind it. It could, of course, involve the development of members of the project team as well. And the activities that are supported would be the project, the outcome, collaborative opportunities. Whereas the fellowship, you normally get it more for a fixed period of time. And a fellowship, depending on your circumstances, and of course, this can change if you've got clinical duties or other duties, it's normally a greater percentage of your time. And a fellowship really offers you the scope to be ambitious, to explore different paths that your fellowship might present itself. They see the fellowship as more as an investment in yourself, your ideas, as well as your future development and your career path. You will notice in many of the fellowship applications, there are more and more boxes that are designed specifically for your personal development, your career development, in addition to the research project. Of course, the activities supported are the research program and outcomes, but there's also a lot more scope for what your training and development needs are. It might be well recognized that you have this research ambition, but at the current point in time, you may not have all of the skills necessary to achieve this. So you'll bring in collaborations, you'll bring in mentors to help train you in order to do this. You might go on secondments. And those activities are generally both encouraged and supported throughout your fellowship. So a fellowship is really about you, your potential, and your potential to become a research leader. Next slide. So the benefits and limitations of the fellowships, and we're talking a lot about fellowships today, but we'll also be weaving in some research project opportunities. So the major benefit of the fellowship, it protects your time to do your research. So if you often find yourself with conflicting priorities, with teaching, with other commitments, a fellowship really does enable you to protect your time in order to do this. You will get fully funded training and development plans. The investment is in you, and of course, we all want to have a good CV, and a fellowship is incredibly prestigious, and it really does set you up for future research. The limitations, of course, is the expectation that you will focus on your research project. If you were to have a suite of research grants, you might be able to diversify your portfolio. But for the fellowship, with that moment in time, it really is about what you plan to do. You do, of course, even though you have the fully funded training and development plans, you do have to balance this with your project delivery. And with most things at the moment in research funding, it is highly competitive to secure the funding that you need to get. Next slide. So just an overview of the types of funding landscape. You would be well aware that to do your research you need funding. And today what Nazia and I will be speaking to you about is mainly focused on the UK government funding landscape, which includes both UKRI and NIHR. But it's also worth noting that there are many charities, trusts and societies that also fund both research projects and fellowship. Now, these can be quite subject focused. So, for example, Yorsa Cancer Research UK, British Heart Foundation. But they can also be more diverse in their funding portfolio. For example, Wellcome Trust will fund projects related to the betterment of human health, the Academy of Medical Sciences as well. There's also international funding opportunities, which can quite often not be highly sought after by our colleagues here at Leeds and within the UK. Luckily, we do still have opportunity to apply for EU funding. So it's well worth going through the European Commission and, of course, the NIH in the United States. There is also opportunities to have your funding, your research funded by industry partners. So if you have some good industry connections or collaborations, they can be a good avenue to support your research, especially within UKRI and Innovate UK. There are opportunities to partner with companies. And next slide. So my team that Nazia and I are a part of within the University of Leeds, we try to look after, promote and support research opportunities through UK Research and Innovation, or UKRI, or UKRI for short. Within UKRI, there are many research councils. So we can see here those are made up of the Arts and Humanities Research Council, Engineering and Physical Sciences, Biotechnology and Biological Sciences, Medical Research Council, Economic and Social Research Council, and you can see the rest there. So all of these research councils sit under the umbrella of UKRI. And I'm sure many of you that are in this room would have heard of at least the MRC, Medical Research Council, or you may have heard of others. But if we go to the next slide, what I really would like to highlight within here is many of the research councils that you may have a conception of perhaps not being appropriate to health and life sciences. You can note that within each of the research priorities, so the AHRC, they look at health disparities. The BBSRC, of course, support real mechanistic understanding of life sciences. You have the EPSRC, and one of their priority areas is health and healthcare. ESRC look at health and social care. Of course, the MRC's major portfolio is in health life sciences. But all of the other research councils, they often have opportunities for health research that you may not have previously considered. So we would really encourage you to look at the UKRI homepage and webpage and not narrow your search too much to certain research councils, which you may think are only appropriate to you, because we're seeing more and more opportunities from the other research councils which may be of interest to your research. So I'll pass along now to Nazia to lead us through some NIHR.
Thank you, Beth, for the overview of the UKRI. So as Beth mentioned, the other UK government funding body is the National Institute for Health and Care Research, or NIHR as it is known. NIHR has its mission, which is overall to improve the health and wealth of the nation through research. And to deliver this mission, NIHR has 6 core work streams, which you can see here on the left side of the slide, on which one of which is about attracting, training, and supporting the best researchers to tackle complex health and social care challenges. And to do this, the NIHR Academy lead on providing academic training, career development, and research capacity development to support and fund opportunities. And the NIHR Academy manages all of the fellowship schemes that I will talk through in a while. So NIHR is one of the largest funders for health and social care research, and it has some remit, means the area that it basically funds in. So the overall remit of NIHR is early translational experimental medicine, clinical and applied health research, and including social care research. And for any of the research that fits into this particular remit, they must have a clear potential for directly benefiting patients, service users, carers, and the public. And they can involve patients, service users, or carers, samples or data from these groups, other people who are not patients or service users, populations, health technology assessment, or health and care services research. So NIHR does not support basic research or work involving animals or their tissue, but NIHR is also keen on supporting high quality educational research and methodological research, provided it has the potential for practical application and impact on patient service users, carers, and public. So there are 7 key priority areas for the NIHR funding, which you can see on the top of the slide. I won't be going into the details because you can have a look at them in your own time. But overall, it's again related to improving the life of people and health and social care. As well as these 7 priorities, more recently, the Department of Health and Social Care published the areas of research interest. So basically, NIHR receives its funding from the Department of Health and Social Care. So these areas of interest are an indication of where the funders and the government want to invest in research. And if you can align your research to one of these areas, it will further strengthen your case for funding. We expect that these areas of research will be delivered using the existing NIHR and Department of Health and Social Care funding routes, and by working in partnership with other funders, for example, the UKRI. So I'll just briefly touch upon a current theme which NIHR has out right now. It is the early action to prevent poor health outcomes. So NIHR is keen to support research which generates high quality research evidence in the evaluation of health and care interventions and services which address gaps in our understanding of preventive strategies, early diagnosis techniques, effective interventions for individuals at increased risk of chronic diseases such as the ones listed here. And of course, this particular theme call is being delivered through different funding programs as is listed here. So in terms of priorities and areas, we are likely to see NIHR funding focus on these aspects in accordance to the new government priorities for health and care. These priorities will underpin a series of specific but linked research funding opportunities. So these include analog to digital research, moving care from hospital to community, and sickness to prevention. So therefore, it is always useful to keep up to date with the government priorities and also the Department of Health and Social Care areas of interest when thinking about developing your research ideas. I think so. Next, Beth, you will be talking about some specific funding opportunities.
So as mentioned, the probably the major funder that we have for health and life sciences within this audience would be the MRC. And a little bit like the NIHR, it funds research at the forefront of science to really prevent illness, develop therapies, and improve human health. And the science areas, the remits, are really important to know, because when you apply for a lot of the MRC funding, you'll actually apply via one of these boards. So there is population and systems medicine, and that this one is really at the edge of where you might go from MRC and tipping into the NIHR space, because it's looking at both the mechanistic and applied research relating to the physiology, pathophysiology of major human organs and systems. This is also looking at population health and the impact of the environmental factors on health and development of the life during the life course. The MRC also see neuroscience and mental health as a priority area, and this is looking at the nervous system, mental illness, and looking at brain tissue. So there's been recently a call for the prevention and treatment of Alzheimer's disease. Another important area is your molecular and cellular medicine. So this is looking at your mechanisms, your technologies for looking at human health and disease. The MRC are really interested in global health, so they're looking for partnerships between low and middle income countries with UK partners to look at global health research opportunities and how they can actually help the populations within those areas. There is the Infections and Immunity Board, which you can imagine tries to tackle infectious diseases, but interestingly as well, disorders of the immune system. One of the major awards that we try here at Leeds to provide funding for is the translation funding that we try to support along the pipeline as well. So the flagship funding of the MRC is the DPFS award, or the Developmental Pathway Funding Scheme, and there is a new scheme which is the GAP funding for early stage development of new healthcare and interventions. This award was due to come out in recently, but they've paused the latest round, and they've told us that they'll be relaunching this funding with a bit of rebranding and a bit of an overhaul. So if you've previously looked at the Gap Fund Award and you thought it wasn't for you, it might be worth revisiting the UKRI website in a couple of months' time to see how this may have changed. Leeds have an internal Impact Accelerator Award. Many other universities have these also. Next slide, please. So the MRC have a wide range of fellowship opportunities, and they come right from the pre-doctoral clinical fellowship to the advanced academic fellowship. And these can include the pre-doctoral clinical research training fellowship. And as you can see on that top line, it mentions that your research can focus on any of the remits. So when you apply for this, you apply for the board. There's the Clinical Scientist Fellowship. Next slide. Postdoctoral Clinical Research Training Fellowship. Ones that are perhaps a little bit less clinical include the Career Development Award. So the MRC don't really have, in terms of non-clinical awards, many early career fellowship. They deal more within the Career Development Award, and this is where you might have had one or two postdocs and you're really looking for that transition into independence. Next slide, please. A really popular MRC fellowship opportunity that we see through Leeds, and especially if you have clinical or teaching obligations, is what's known as the New Investigator Research Grant, or the NIHR. And this also is a fairly late stage career development, even though it says New Investigator, again applicable through all of the MRC's remit. And what's interesting about this award, it's a fellowship where 50% of your contracted time will be spent on this fellowship. So if you have, as I mentioned, other responsibilities within the university, your research time can be purely spent on this fellowship, and it's for 3 years. So it's a really nice opportunity to get into some fellowship if you don't have 100% research within your contract. Next slide. So this week I have been looking through the UKRI funding opportunities, and many of the research boards, they haven't had many new bespoke or responsive mode opportunities recently, and that's because many of these research councils are waiting for their next budgets, are waiting for their autumn reports. But what the MRC have, as well as other research councils, are rolling funding opportunities. So this is stepping away from the fellowship opportunities and more into the research grants. And the MRC have 3 levels of research grants. The one level is research grants, the next are your partnership grants, and then further on to that are your program grants. So the research grant, they can fund projects that last up to 5 years. They typically last 3 to 4 years. And if it will go longer than 3 years, you just need to justify your reason. Now, why I would like to bring this to your attention is because many people think a research grant needs to be at least 3 years, and it needs to be fairly comprehensive. But through recent intelligence from the MRC, you can see here with the second point where it mentions that if your project would last less than 2 years, it must be a proof of principle or a pilot work. And this is a really interesting opportunity because it shows that you can have something that's quite risky, that you want to test, that you want to see if it's feasible before moving on to that next larger piece of work. So even though there is no limit to the amount of funding, that it's up to about 5 years, there's no reason why you can't be aiming some really early stage pilot exciting work for the research grant opportunities within the MRC opportunities. We can also see that there are partnership grants. Now, these grants are really to help if you have met some potential new collaborators that you want to work together, perhaps for the first time or in a different way than what you may have worked through before. A partnership grant is designed to enable you to perhaps do that. The peak of the MRC grant funds is the program grants, and these really are your ambitious 5-year work, the sky is the limit, go for it funding opportunities. But if you could take away that, if you feel a fellowship isn't for you right now, or if you have a really exciting but short research grant proposal, if you're at Leeds, speak to me. We can get ideas from our strategy group, but you don't necessarily have to go for 3 years. You can do these shorter pieces of work through the MRC. And I believe, Nazia, you're doing some NIHR funding opportunities next.
Yes, thank you, Beth. The NIHR funding landscape is also quite wide and complex, and it is navigated and managed by multiple different coordinating centers. So NIHR from this year have harmonized the application processes and systems. So if you have previously applied for NIHR fellowship or other research grants, you would have to use different platforms, but now they have nice application processes and systems with a new NIHR award management platform. In terms of funding opportunities, these are basically the simplified versions of the 4 funding opportunities that the NIHR offers. So the first one in the blue on the left side is the funding for career development and academic training. This is where all the fellowships come under, and I will be discussing about fellowships in the next couple of slides. Then, of course, we have the domestic programs, which provides funding for projects and programs of research. And there are a variety of themes and topics which basically fall under these programs. Like the MRC, NIHR is also interested in global health and provides funding for research programs that benefit people in low and middle income countries. NIHR also funds infrastructure, and the University of Leeds has been quite successful in getting some of these infrastructures funded. For example, one of them is the BRC, which basically everyone in the audience is aware of. And there are other few which have been underlined in the list that also the University of Leeds is either leading on or is partner with. So I will delve more in depth about the NIHR fellowships, because I think so the audience here might find this more suitable for their career development in research. So as Yusuf Sale in the beginning has mentioned, that NIHR has now simplified their offers. So previously, as you can see on the right side of the slides, there were a lot of awards which now have been simplified into 3 categories. So now we have the pre-doctoral awards, the doctoral awards, and the postdoctoral awards. So all the previous awards, such as what you call as PCAF, the local authority fellowships, all of them have now, for example, come under the pre-doctoral category. The doctoral fellowships, the DCAFs, and the DLAFs have now come under the doctoral fellowship awards. And similarly for postdoctoral awards, we have all the advanced fellowships, the ACAFs and the ALAFs again come through the postdoctoral fellowship awards. And basically they will each have just one call open, and you can apply for these schemes through one single call. So apart from the 3 stages of careers that I have discussed, that is pre-doc, doctoral, and postdoctoral, there are also other fun career development opportunities, which include some initial experiences, such as about the Insight program. Beyond the postdoctoral fellowships, you also have professorships and chair funding opportunities, which is again for more senior investigators or those who are basically applying for research professorships. While Beth has talked in detail about the MRC opportunities, and I have talked in detail a bit about the NIHR fellowships opportunities, these are not the only funders. So as Beth had discussed previously, that the funding landscape is quite large. We also have charities who give funding. So you can see there's a range of funding opportunities available for all different career stages, which includes funding opportunities from the Cancer Research UK. It includes funding opportunities from Wellcome, from the Academy of Medical Sciences. And again, depending on whether you are a clinical researcher or not, you have different opportunities. I won't be going through all of them, but if these slides will be shared, all of these are clickable links. Again, this is not an exhaustive link. It only includes the UK government funders, as well as Wellcome Trust, Academy of Medical Sciences, BHF, and CRUK. There are a lot of other disease-specific charities and other routes where other funders whom you can apply fellowships for. So the next slide this particular slide basically talks through different fellowship schemes that are available for non-clinical researchers. And again, this is not an exhaustive list, and it will be always useful to explore other opportunities as well, depending on your area of research. So again, how do you find bespoke funding opportunities? Because it's such a huge landscape, you can't really keep on top of things until you know how to find them. So one of the first ways to find is through the funder website. I've listed here some of the funders. Again, this is not an exhaustive list, but if you keep just looking at these funder websites, you will find the latest funding opportunities because as Beth has already mentioned, this the funding landscape is quite rapidly evolving. So there might be new opportunities that might come up. Some other opportunities may be rebranded or paused for some while. So it's always useful to go to the funder website to see what all is the latest funding opportunities available for you. One of the other ways and a very useful way of finding research opportunities is to create your own account on PivotRP. So University of Leeds is subscribed to PivotRP. Um, and you can log in through your email ID, create an account, and create your own bespoke funding opportunities alert where you put in some key research areas and kind of research that you want to do a fellowship in or apply for a grant for, and then it will generate you a list which will keep updating regularly because as new opportunities come in on the websites, it will come on PivotRP. Again, I would say PivotRP may not pick up all of them, so it's always useful to keep refining your refining your search and looking for opportunities. If you are within the University of Leeds and have a University of Leeds email ID, I would highly recommend signing up to the email networks. Again, the link to the email networks is here. And how do you access them is also given in that link. Also, if you are at a faculty or an institute, there will be internal mailing lists where you might be where certain funding opportunities and internal funding opportunities may be circulated. For the University of Leeds staff, there is a FMH ECR Academy, which basically where people post a lot of opportunities for early career researchers. So it might be worth joining this a Teams page as well. I'll just in the end touch through some of the support and contacts. So in terms of the support for the NIHR fellowships application development, we have a support program which is right now ongoing. We already had the intention to submit a deadline last week. However, if you are still interested in getting support and applying for the NIHR fellowships in the upcoming rounds, please do get in touch with me. We also have a number of support sessions which are open for all to attend, whether you're applying for the NIHR fellowships in this round or upcoming rounds, or in general want to know about NIHR, you're most welcome to join. Again, this is not to emphasize that we are only supporting NIHR fellowships. We also support all kinds of different fellowships that we have mentioned, which includes MRC, and as well as other NIHR fellowships. We do also have support, for example, for CR UK. Please do get in touch with me or Beth if you want to find out about support for other fellowships. Just a quick one that these are the different support sessions that we are delivering in the next 1 month, which is more tailored for the NIHR fellowships, but other people are also welcome to join them. You will have to click on the link to register for each session individually. Again, here are the email IDs for Beth, who basically is the MRC and Welcome Funding Lead, but she would also be happy to guide you to the correct person if you have any other UKRI fellowships you want to apply for. I am the fellowship support lead for the Faculty of Medicine and Health at the University of Leeds. So please do get in touch with me if you're keen to apply for any fellowships. Emma Tolson is the NIHR funding lead at University of Leeds. If you are looking for getting some costings done, the generic email ID for the Faculty of Medicine and Health Research Office is here. I've also included the contact ID for NIHR. So if you have any other generic questions about fellowships and other things, you can always get in touch with this email ID and they do respond. In the end, I would just want to touch upon the research support service offered by the NIHR. So this is not only so they provide guidance and one-to-one support for applications, and not only for the NIHR funding applications, but also in general about funding applications which lie in the area of health and social care research. Again, contact the Hub or Specialist Center according to the needs of your research project rather than where you are located. So there's again a list of about 8 hubs you can contact according to which research needs you need to get supported by on. So with this, I end our presentation, and we are happy to take any questions.
Okay, so thank you, Beth and Nazia, for a tour de force about funding opportunities, from learning how to differentiate between fellowship and program grants, towards NIHR and UKRI remits. So if you do have any questions, please put on this chat. Then I can read out to the panels. So I probably can start, kick off with my own question. Just because we do have quite a lot of diverse, people with diverse backgrounds in this call. I'm just wondering, in terms of timelines and preparation, what would you advise roughly, usually, how many months, do people need to, prepare in advance and to liaise with you all as well, so that we can secure a good application in?
Beth, do you want to take it, or should I take that?
Either. I think really the sooner the better. At Leeds, we have, as mentioned, we've had success stories with fellowships, we have strategy groups, and really, I think for a fellowship, people can really underestimate just how long it takes to write it, because not only do you have to think about the project, but yourself as well as your chosen location. So I think it's probably reasonable for your first fellowship application for it to take about 6 months. And we would really like to start seeing drafts of that normally at least a couple of months before the deadline, so we can get it out to the reviewers, so that the reviewers can have time to consider. We can provide the feedback, and there's time to actually do something with the feedback. Many of the fellowships, as we've mentioned, they're rolling opportunities, so it might not just be once a year, there could be a few times a year. So it's always best to wait to prepare the strongest application. I'm not sure if you've got more to add, Nazia.
Yeah, completely. Whatever Beth has said, it's absolutely, that is what, at least 6 months, because I mean, again, if it's your first fellowship, we might have to start working on it a bit more earlier. Like, for example, this NIHR support program that I mentioned, even though you might not be applying for the upcoming rounds, we encourage people to come and attend the sessions, even if they're thinking of applying in the next round, which is towards the end of the year or early next year, so that they can at least start thinking about what all is required for a fellowship. And one of the important things that you need to do when you think of applying for a fellowship is to get in touch with the head of your school or institute, because that is, you need to have their support and their letters of support with your application to ensure that you have the right support right from the beginning. And it's not that after you're finished thinking about a fellowship and applying for it, and then you realize you don't have the support from your institute or school. So that's one of the initial things that you need to take care of right at the beginning.
So in terms of the number of times that people can apply, so for example, if someone who submitted an application, got an interview, unfortunately couldn't get it. I think in the past, like potentially NIHR might have given about 2 goes within 5 years. I mean, is that still the case? And what is the case for UKRI, like MRC and Welcome?
Yeah, so for NIHR, yes, they allow 2 attempts, and they should have a minimum difference of 12 months between 2 submissions. So yeah, that's why we encourage, unless you really absolutely have a good application the first attempt itself, we do encourage them to wait for the next round. So Beth can fill in about the UKRI and other fellowships.
Similar, most UKRI and Welcome fellowships, you get 2 attempts. UKRI normally want 12 months in between submissions, but I can check that. I know for their research grants, it's 12 months in between. Welcome, you get 2 shots as well, but you can apply. There's not that time restriction. So you get 2 attempts, but you could go get the feedback and almost apply immediately if you wanted to.
Do we have any other questions from the audience to the panels? So while they're still thinking, probably just trying to discuss about, the more, the support that, you also providing, certainly when I used to apply for fellowship, I got so much support from you guys. So apart from the fellowship preparation, would you like to also explain what else support's available, for examples like interview preparation and so forth?
Yes, so our team in general does provide support for preparation for example, NIHR fellowships as well as MRC and other UKRI fellowships. So we generally tell applicants that first of all to get in touch with us when you're applying for a fellowship. But even if, for example, they were not aware of us, as soon as they get a interview call, or even if they're anticipating an interview call, to get in touch with us, so that we do help them set up one mock interview. And we generally ask them to also coordinate with their schools and institutes to set up more practice interviews, because the mock interview that we set up would usually be one of the final ones, more nearer to the actual interview date, so they can have like a go at their like questions and presentation preparation before that, so that when they come to the mock interview organized by us, they are a bit more prepared and they get feedback, because we tend to replicate the format of the actual interview. So we have a panel, we have panel discussions and extensive feedback. So that's what we do provide support for NIHR, UKRI fellowship interviews, yeah.
Also, we also do have a lot of questions sometimes when we're trying to apply, for this fellowship, whether our project is too expensive. So would you like to comment about that a bit? Like, how much is it expensive, depending on your fellowship program, or actually is just really the value of money that you're bringing to the table and so on. Yeah. Mm-hmm.
Beth, do you want to go for that?
So I think do you mean like the actual, when you're costing up your fellowships and so forth? I think, so at least for Welcome, for the Career Development Award and MRC, they tend to have, at the top end, it tends to not have a budget like restriction. What they're looking for is, value for money. Sometimes you can't help the costing, so there are overhead costs that we can't change, but what they're looking for is robust justification of the costings that you're going for. And what can happen, and that can be part, once you are developing your proposal, get in contact with your finance research office, those that would do the costings for you as soon as possible, so you can get a proper understanding of how much it would cost, what costs you would have for your public and public engagement groups, what costs you will have for your collaborators, and that way from the outset, and you can really make a strong justification. But some research unfortunately is expensive.
Yeah, absolutely. So one thing that I would want to add is that we advise the applicants to have a look at the previously and recently awarded fellowships or grants, so that they know that what kind of ranges they were awarded and what kind of things they were in the applications that that they included. So that helps them benchmark their research idea and know that, okay, this is the limit that we should try to limit. Of course, you can, if your area is too unique, of course, you might not find the exact suitable examples, but it's always useful to go on. For example, NIHR has their own awards, funded awards website. We can look at awarded fellowships and research grants, and similarly for UKRI, there's Gateway to Research, where you can look at the previously awarded research grants and fellowships.
I've just put the link for Gateway to Research in the chat. So if you're interested in any of the UKRI funding, you can go there and you can see what recently awarded projects there has been. And I think Emma has just put in the ones for NIHR.
Mm-hmm.
Yeah, so thank you, Emma Tolson, for putting that link in the chat. So I think we probably can wrap up the session now, unless anyone else have a burning question. You know, I can give you about 30 seconds. If no one wants to ask question, I think we probably can wrap it up.
More than happy. If anyone wants to email me about UKRI1, just pop me an email and I can see what I can do.
And yes, anything fellowship related, please do send me an email. And of course, like me and Beth, we can always get you in touch with more appropriate people if we are not the ones. But yes, please feel free to drop us an email.
Yeah, absolutely. Because from my experience working with you all, you were so tremendously helpful. So before we end the session, so I'd just like to share that QR code again, in case you missed in the beginning of the session. So we like to keep to obtain feedback from you all today, to see what's done good and what else can be improved, and also what else you want to be included in the next seminar series online. So if you do have your camera phone today, so you can snap that QR code there and fill the survey. It only takes about 2 to 3 minutes. Otherwise, we will also send this link after the meeting to your emails as well. Just letting you know that our next series will be in 2 weeks' time. So following these funding opportunities, after this, we will then learn how to submit and also obtain a successful grant writing. So this will be on a Wednesday, 19th of March, nearly the same time, lunchtime. So we'll have both Professor Heidi Siddle, who is a consultant podiatrist and also a professor, and also Professor David Russell, who is a vascular surgeon and also a professor as well. Both of them are in the NIHR panel committee, so they will provide insights on successful grant writing and also insight from the perspective of committee as well. So I hope we will see you all there. So we will draw the meeting to the close. I would like to thank Dr. Nazia Nasir and also Dr. Bethny Morrissey for enlightening us about funding opportunities, and also Emma Tolson in here as well in our meeting today. And have a nice day, everyone. Okay, bye-bye.